so I'm free to start. Okay, so the first thing I'm going to assess is your scalp, your head. And may I touch? Perfect. Okay, so I'm going to assess the hairline, the scalp, and I don't see any bruises, any lacerations, any contusion. Do you have any pain? Okay, and your hair, it looks like you don't have any hair, but should patient have any hair, you should see there is no signs of alopecia, and the hair should be evenly distributed, or sometimes they're not, whatever it looks like, but patient has no hair. Okay, perfect. Okay, so I would also be changing my gloves, so in case your hands gets dirty, because the scalp can be greasy. Sometimes you find strange things on the scalp, okay? Like lacerations, bleeding, things like that. So change your gloves. Okay, at this time I'm going to proceed with your face. Okay, I'm gonna check for sinuses. Does it feel hard when I touch? Wait, how about here? Oh, okay, all right. Let me check moisture. Okay, perfect. Okay, and now I'm going to use my pen light.
Can you guys see? You can come closer this way.
Yes. Okay. Now I'm going to assess your visual fields. Well, first I want your pupils reaction. I'm gonna dim the light a little bit, and I'm going to start from here. Okay, our pupils are connected to light. Okay, perfect. Okay, and now I'm going to do something called 6 visual fields, where I'm going to ask you not to move your head, but to follow this pen light with your eyes, but not with your head. Is that all right? So 1, center, 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 center. Perfect. So patient's eyes, pupils, perla, and visual fields are normal. Perfect. Okay, and now I'm going to assess your nostrils. All right, the nostrils, I see your mucous membrane is normal. I don't see any excess, any bleeding, anything like that. And you have your hairline are also evenly distributed in there. Okay, perfect. And now I'm going to ask you to say ah, open your mouth for me. And I'm using the tongue depressor, and say ah for me. Perfect. And I'm checking inside your mouth. I see your uvula is midline. Your mucous membrane is taken moist. And may I ask you, are these all your teeth? Okay, so no dentures. Okay, no missing teeth. Perfect. And your lips are pink and moist. Perfect. Okay. And last thing I'm gonna do from pen light is to check inside the ear. I don't see any excess rumen. Behind the ear, no signs of pressure ulcers, nothing like that. So we are good. So I would do the same thing on the other side, but 6 CPE purpose, only one side is okay. So I'm done with this. Perfect. And now I'm going to move forward to your neck. Okay, so I'm going to ask you to swallow for me. Your trachea is midline, and I'm going to assess your carotid pulse one at a time. Present. So one at a time. And trachea is midline. Pulse, carotid pulse, one at a time. Perfect. Okay. Can you swallow for me? Also, I want to check your jugular vein. I don't see there's no jugular vein distension on both sides. Perfect. Okay. Now I'm going to assess your respiratory status. I am going to expose your chest a little bit. I see your chest rise and fall perfectly. And I only expose parts that needs to be exposed. And I'm starting here. This is your suprasternal notch. And 2 finger below is your angului. And I'm going to listen to your breath sounds. I'm gonna ask you to gently breathe in and out for me. I'm gonna assess 8 front and 8 in the back. Just breathe for me normally. Thank you. Perfect. And the last 2 right here. Perfect. Okay. And now I'm going to have you sit so I could, because some breathe for me. In and out. Breathe in, breathe out. I'm checking your chest expansion, and it's equal bilaterally. It's normal, okay? And I'm also checking the AP diameter is 1 to 2, okay? All right, so before I have you laying down, I'm checking your spinal. I don't see any signs of kyphosis, lordosis, or scoliosis. Your line is straight, midline, perfect. And when you stand, I'll check your sacral area. 5 cardiac sounds. So the first one, I'm going to expose the chest, is first on a second intercostal. Intercostal is between the ribs. Your second intercostal, right, this is your aorta. I'm gonna listen for S1, S2. Straight across, left, pulmonic. Third, herbs, tricuspid, and then mid-clavicular, straight right beneath your breast is your mitral valve. This is also where I will listen to your apical pulse for a full minute. And everything seems to be normal. Perfect, thank you. And while I'm down here, now I'm going to listen to your abdomen. I'm going to inspect your abdomen, and I only need to expose that part right here. Okay, so the first thing I'm going to do is to inspect. I don't see any bruises. Your shape, your abdominal seem to be in good shape as far as a contour. I don't see any distension. Let me ask you, when was the last time you had a bowel movement? And is it normal? Was it normal? You had no straining? Okay, and the second thing I'm going to do is to listen to your bowel sounds. Quadrant. Okay. Bowel sounds normal. Bowel sounds normal. Perfect. All right, and third thing now is light palpation right here. Is there any discomfort? Perfect, thank you. And we're not doing any heavy palpation, and I'm not percussing anything. Perfect. So I'm done with the abdominal or the GI assessment, and now I'm moving down to the GU assessment. First, I am inspecting. I don't see any signs of distension, anything like that. And you don't mind if I just lightly palpate? Okay, does that hurt you? Okay, I noticed that you have urine on the table. When was the last time you had this urine? Morning, okay. I don't see any signs of infection, no cloudiness, nothing, no particles floating around it. However, it's a little concentrated. There's no signs of infection. Okay, all right, perfect. Now I will be changing my gloves. Okay, now I'm going to continue with my circulatory system. I did the carotid pulse, and now I'm doing the brachial assessment bilaterally. Down this way, radial pulse, thank you, bilaterally. Okay, toward and now your capillary refill, less than 3 seconds, normal. Okay, squeeze my arms. Okay, perfect. Okay, can you raise both of your hands?
Yes.
Perfect. Okay, and now I'm going to proceed with my circulatory system, checking your popliteal pulse, normal. Down this way. Before I go down to your toes, I'm looking at your legs. I don't see your hairlines are evenly distributed. I don't see any signs of edema. So let me feel for moisture. No pain. And now I'm going to feel your pedal pulse, which is right here. Pedal pulse is +2. And now I am checking the toenails, capillary refill. In between each toes, no signs of fungus, no cracks, no infection. Perfect. Same thing, capillary refill in between the toenails. And now checking one foot at a time. No cracks. The heels are intact. No pressure sores noted, right? And no pallor. Perfect. Great job. I'm going to ask you to just push downward, checking for strength. Okay. And we are not going to push it forward for home and signs. We're not doing that. But can you raise both of the legs for me? Okay, perfect. And when the patient stands, also you could do more of that. Now, at this time, I'm going to change my gloves again, okay? All right, so I changed my gloves. Now, before I get patient out of bed, this is your tactile stimulation. Just so you know, I will be testing for sensation. I have soft and sharp, and you let me, I'm going to touch or point to somebody's parts and you tell me whether you feel soft or sharp, okay? Bilaterally. And where is that? Perfect. At the side, perfect. Down this way, so correct. Ask patient also to close their eyes before you do that. Perfect, thank you, that's all. Okay, now to conclude our head to toe assessment, may I ask you to step down out of the bed, because I'm going to check your musculoskeletal and see also your if you have any dizziness while you're walking, your balance per se. Okay, all right, perfect. Okay, so you're out of the bed. Do you feel any dizziness? Ask you to raise both of your arms. Okay, perfect. And you reach out down to your toes. Perfect. At this side, you could check the sacral area. Okay, now I'm gonna ask you to have your right foot away from your body. That's abduction. And bring it together toward the center. That's abduction. Same thing with the left, away from your body. Okay, bring it to the center. This is abduction. Okay, how about you do 3 steps forward for me? 1, 2, 3. Turn around, please. 3 steps. Perfect. Okay, can you have your head down, your chin? Okay, perfect. So I'm gonna have you back to bed and give you your call light, because that concludes our assessment for today.